Aloha and congratulations on the upcoming birth of your baby. Thank you for choosing Kaiser Permanente to care for you during this exciting event. It is important that your birth experience is positive and memorable. This video was made to help explain your pain relief options during labor and delivery. What is anesthesia? Anesthesia is the use of medications and/or procedures to reduce pain. Who gives anesthesia for labor and delivery? Anesthesia in labor and delivery is given by certified registered nurse anesthetists. They are also called CRNAs. At Kaiser Permanente, we have dedicated CRNAs who specialize in labor and delivery anesthesia. CRNAs are in the hospital 24/7 for your safety and comfort. They are all advanced practice nurses with master's degrees and specialized training. They provide epidurals for labor and also spinal and general anesthesia for cesarean sections. CRNAs work as a team with anesthesiologists, OB doctors, midwives, and nurses. What will labor pain feel like? Labor pain is an individual experience. Everyone sees pain differently, even from one pregnancy to the next. There are 2 stages of labor. In stage 1 of active labor, your cervix dilates from 4 centimeters to 10 centimeters. Pain comes from the uterus contracting and the cervix stretching. Pain can be felt in the belly, side, or back. Location of the pain depends on the position of the baby's head. In stage 2 of active labor, you enter the pushing phase. This is when your cervix is dilated to 10 centimeters to the time you deliver the baby. Pain comes from stretching of your vagina and perineum. You feel intense pressure and a sensation of bearing down. What are my options for pain control? IV pain medication is medication in liquid form. It is injected into your vein through an IV catheter. The medication given is usually fentanyl or morphine. Sometimes a medication called Phenergan is also given to help prevent nausea and help you rest. IV pain medication can help you to relax in early labor. These medications can cause nausea, vomiting, and/or drowsiness. They also cross the placenta to baby. This means that the baby will get some medication in its system too. Epidural anesthesia is usually an option once active labor begins. The epidural provides pain relief with minimal effects on the baby. Pain relief can take some time because the epidural requires more monitoring and equipment than other pain control options. What is an epidural? Epi means outside of. The dura is a sac that surrounds the spinal cord and fluid. Having an epidural means that a thin, flexible catheter is placed in the epidural space, the space outside of the dural sac. Your CRNA will use sterile technique to find the epidural space with a large needle. A catheter will be inserted through the needle. Then, the needle will be removed. The catheter is used to deliver pain medication into your body at a steady rate. Medications are injected into the catheter to give pain relief. After the baby is born, the catheter is removed. Does the epidural procedure hurt? Getting an epidural should not hurt. Medication will be injected into your skin to numb the area. This is called local anesthetic or numbing medication. It feels like a pinch and burn sensation. After that, the needle placement should only feel like pressure. What are the benefits of epidural anesthesia? An epidural can make labor more comfortable. It can also help labor progress. Medication given through the epidural does not cross the placenta. It does not affect the baby. If you need a C-section, the epidural can be used as an anesthesia for the procedure. What are the disadvantages of epidural anesthesia? It can lower blood pressure. If you have an epidural, you will be closely monitored. If your blood pressure drops, you may need IV fluids or medications to help you. It can take up to 20 minutes for an epidural to work. Having an epidural means you can't get up and use the bathroom. For your safety, you must stay in bed because your legs will be numb. You will need to have a catheter inserted in your bladder to collect your urine. This will be removed after the epidural is removed. You can't eat or drink if you have an epidural. You can only have ice chips. What are the risks involved with an epidural? A spinal headache can occur. This is when the dural sac is accidentally punctured and fluid leaks out. This happens about 1% of the time. Your back may get bruised where the needle is inserted. The epidural may need to be replaced if you have one-sided or inadequate pain relief. Rare risks are bleeding, infection, seizure, or feeling numb after the epidural is removed.
What happens during the epidural procedure? After an epidural is requested, the CRNA will do a brief history and physical, explain the epidural, and get informed consent. One support person will usually be allowed to stay during the procedure. This person must be sitting for safety reasons. During the procedure, getting in the proper position is important for epidural placement. You will need to sit on the side of the bed, relax, and sit slouched over the baby. Try not to arch your back or sit up straight. The procedure typically takes 5 to 10 minutes, sometimes longer. Once the epidural is placed, it can take up to 20 minutes for the medication to take its full effect. The goal of the epidural is to make contractions tolerable. You may still have some sensation or feeling when you have a contraction. This is normal. Contact the Family Birth Center at 808-432-8550 if you have any questions about pain management and epidurals during labor and delivery. Visit kpfamilybirthcenter.org to view and download an epidural FAQ sheet. You can also contact your provider, physician, nurse practitioner, or midwife taking care of you during your pregnancy.